Alright, today we'll be talking about gastric cancer. Gastric cancer simply means stomach cancer. So, just like I've mentioned in a previous video, cancer occurs everywhere. So, when cancer happens to the stomach, we call it a gastric cancer. So, what are the things that we see, or what are the symptoms that people notice that make them to suspect that they have gastric cancer? Firstly, they have problem with eating, they eat less, or they get full on time while eating very little. Sometimes they do not pass through for a long time, which is called constipation. Sometimes they vomit when there is an obstruction. That means there is an obstruction to the flow of food into their stomach. Sometimes they have weight loss, they have loss of appetite, sometimes they feel dizzy. So what are the things that put us at risk of having gastric cancer? The first and foremost, which is quite common in this part of the world, is ulcer. So it's called peptic ulcer. That's ulcer. That's very in the way of the lining of the stomach. So when this happens for a very long time, it leads to cancer. So we've seen quite a lot of people that present to the hospital with ulcer, treating ulcer, taking a lot of antacids. But in the long run, they however had cancer. So this is one of the major risk factors. Another one that is very concerning is family history. Having a first degree family, like your mother, your father, or any of your siblings, having gastric cancer also puts you at risk. Another major one is smoking and alcohol. People that take a lot of cigarettes or tobacco and drink alcohol, they have been shown to be prone to having gastric cancer. And the last one is genetic predisposition. There are some genes in our body that whenever they change shape, which is called mutation, also put us at risk of having gastric cancer. How do we prevent gastric cancer? It's quite important that we prevent it. People that have ulcer, that have been treating ulcer for a long time, especially those above the age of 40 years, it is encouraged for us to do a camera test, which we call endoscopy. This camera test helps us to visualize the inner lining of our stomach and also to detect any ulcer as soon as possible so that treatment can be done. Another way to prevent it is by avoiding smoking. I know that some of us cannot do without smoking, but of what importance is something that causes a lot of harm to us than good. Why not just stop smoking to us so that it can prevent you from having a series of cancers? Also, it's also advisable to reduce our alcohol intake. It is very, very important. And also, if there's a family history or any of our relatives have any form of cancer, especially this gastric cancer that we're talking about, it is quite important that we get checked as soon as possible. So the rule is anybody above the age of 40 with either a family history of gastric cancer or that have been treating ulcer for a very long time, they should come to the hospital to get tested by doing a camera test. Thank you for listening to me on today's episode of Cancer Care on my channel. I look forward to your comments and do not hesitate to share, to like, and to show your friends about this new channel.